fun-filled facts. What we're going to move on to now is that Q&A and some questions that are often raised in a variety of settings of us, common questions we get. And the sort of title and the lead-in and the point of tonight is to really introduce some of the things that we wish patients knew. So what are some of those key information tidbits that if we could shout them from the mountaintops to our women who are GYN cancer survivors, their caregivers, their family, their friends, to our very broad audience, what do we wish we could tell people if we had a microphone, the page one above the fold of the New York Times? This part I will not call on anybody, or I'll try not to, but does anybody want to go first? And if so, just speak up.
I'll start. So I would say, if the one headline I would want everyone to know is you're not alone. And I hope that you'll take that away from this session tonight, just to see how big our team is. And this is just like a small part of the team. It's just, you have this huge team of people who are all working, many or most of them behind the scenes, to take care of you. And the longer you're with us, I think you get a better sense of that. But especially when you're first meeting us and you think you're just coming to see one doctor, you're coming to see an entire team of people. And so you're not alone. I think that would be my most important thing.
And then I just want to follow up on that, Stuart. I love that. And I think it's so true. And I think it's important for us also as providers, right, that we're not alone, that we have each other. And that's such a vital part of being, a caregiver, a person who takes care of patients, that we have our team. And I think the other thing, because a lot of patients and their families have had, some experience with cancer before, unfortunately. And the way that it's sort of traditionally set up in terms of the team is that you have sort of separate people doing maybe your surgery and then medical oncology and, sort of all the parts of it. And GYN oncologists are sort of weird. And we're sort of the last holdout, I think, of, this breed of surgical oncologists who is heavily involved and often does a large part of the medical oncology side of it in terms of chemotherapy and maintenance therapies. We can certainly talk about that. We do a lot of palliative care, we know a lot of intensive care medicine. And so it's a little bit unusual, I think, getting care from a GYN oncologist, and many, I think, patients and their families aren't really familiar with that type of physician.
I think something that I would say to piggyback both on what Dr. Ferris and Dr. Stone have said about teamwork is reminding also patients that you're part of that team. Your report of symptoms, of concerns are imperative to help us take the best care of you. And you being a part of that dialogue is so, so important to us. And so to really encourage all patients to never be afraid to speak up, to ask questions, because you are just a part, the biggest part of the team, I would say.
And I think to piggyback off of that, one of the things I kind of wrote down was basically, there are no right or wrong questions. You don't have to ask your prognosis. If you never want to know it, it's fine. If you want to know it day one, that's fine. We have lots of information, and our job is to basically figure out what is the best treatment for you and how do you want us to communicate that to you. And so some people want to know every number that ever existed every single time they get chemo, and some people just want to know that they're doing fine. They don't need the details. So I think on TV, you often see, it's like, oh, I have cancer. How many months do I have to live? That kind of thing. And that is not the reality. It is something that shifts as you're treating a patient. Prognosis shifts. It can get better. It can get worse. And so knowing how you want to be, how you want to communicate, how much information you want to get, who you want involved, do you always want your family there when you're hearing news, whether that's good or bad? I think those are, everyone is unique and you can have your own opinion about how you want that communicated. And we're here to kind of work with you to make sure every patient gets what they need.
I certainly agree with everything that's been said. I have a little bit of a one-track mind, and it tends to be focused around clinical trials. So my one thing about clinical trials that I want everyone to know is that I think a lot of times people think about clinical trials as something you do after things have not worked. And that's not really the case. And there are situations where the most appropriate thing may be a clinical trial, and there are lots of situations where it's not necessarily the case that a clinical trial is the best option. But asking that question early and talking to your providers about clinical trials and where they may make sense for you early, and getting to know about them. I really wish it was something that just the general population knew was available in terms of their medical care. I spend so much of my time just explaining what is a clinical trial and when might one consider it. And oftentimes I get the question of, oh, well, I should only really do that after I've had all these other therapies and they haven't worked. And that's not the case. So spread the word. Clinical trials are an important part of cancer care from the very beginning.
Yeah, I think that's right. To piggyback a little bit. Oh, Amy, were you going to go ahead?
Yeah, if there's time, is there time? Mine rhymes. Mine is do not wait to communicate. And this is for when you're an inpatient. Do not wait to tell us when you have pain, when you have nausea, when something doesn't feel right. Don't hold it in and wait until change of shift. Tell us early. If you're at home, and if you're sitting at home after you've been in the hospital or any time and you're having some kind of symptom, and you're sitting around thinking, should I call? Should I call? Is this important? Don't hesitate. Don't wait to communicate. Problems are so much easier to handle when they're small than when they're big. So don't hesitate to tell us what's going on with you early on. That's true when you're at home. That's true when you're here on Weinberg 4B. Also, with regard to do not wait to communicate, do not put off those crucial conversations with your family and the people closest to you about what's important to you. How do you define quality of life? And another fun fact about me is that I have a degree in death, dying, and bereavement. And so I'm very focused on quality of life and how to, for all of us, it wouldn't matter to me if this webinar was for Olympic athletes. Everyone should have an advanced directive. Everyone should have an advanced directive. Everyone should have those crucial conversations with the people they love most. Again, how do you define quality of life? There's Dr. Fader. And, what's most important to you? Okay, that's it for me. I'll mute myself.
I definitely don't want us to lose our train of thought, and I have some thoughts and questions and things I was going to say as they come in, but since Dr. Fader's here and she didn't get to introduce herself before, I'm going to let her go ahead and take a minute. We did a 1 to 2 minute elevator pitch on who you are, what you do with KGOS, and then a fun-filled factoid.
Ooh.
Do you want a sec to think?
Yeah. Actually, hi everybody. I don't want to interrupt too much. No. I'm Amanda Fader. I'm a GYN oncologist with the Kelly service. I work with all these wonderful people, and I specialize in rare ovarian and uterine cancers, and really enjoy doing research and clinical care for women with uncommon malignancies and helping us give the best state-of-the-art care that we can in a very personalized fashion. A fun factoid about me. I was in a beauty pageant once when I was 18 years old, which is crazy, I know, but
that's a good fun-filled fact, and it makes your AAGL appearance this year make so much more sense. Now I get it.
It's not the highest highlight in my life, but yeah, so that's that.
Thanks for joining us. As I mentioned, a couple of us are coming in and out of clinical stuff, so we'll just flex as things go. So we're glad you had a sec to come by. So I definitely, I think the one thing I always say to patients when they ask, what do you wish I knew, or when I give talks on this topic and have to answer questions, I always say, One thing I wish everybody knew is it's a roller coaster. So many things in our life are like linear paths, and we make plans and then we enact the plan. And the cancer journey, there's many different metaphors that people use. Some people use the fight metaphor. Some people use the journey metaphor. There's lots of different metaphors. And I always think the roller coaster is a really good metaphor, because they're really high highs where you're on top, you're looking at the roller coaster's just sort of cruising and you're enjoying things. And there's sudden drops that you don't expect. And then even when you're down in that valley, there are these sudden peaks again that come out of nowhere. And so I think that roller coaster is something that I always emphasize to people when they ask me, like, what do you wish I knew? A little bit of, I can't quite predict. And so we're just going to ride a roller coaster together is something. Dr. Liu, you mentioned earlier in your little introduction, you mentioned advocacy and sort of hinted at that was one of the things you wish people knew. Would you be willing to expand on that a little bit? I think it's a great point, actually, that didn't come out in what was said.
No, I think it kind of ties into what I was talking about with the patient being really kind of the most important team member. Because I think throughout this process, a lot of patients just feel like this huge weight has landed in their lap, and it's so overwhelming. And it's really tying into what so many people have said already, that you're not alone, and understanding, part of our job is really to understand the challenges that each patient faces, which is different. And I think that that's where part of the personalized medicine is really just meeting each patient where they are. Because they're coming from all different walks of life. They have different educational, social backgrounds, economic backgrounds, and it's really important for us as providers, as clinicians, to really recognize and understand what each person's circumstances. And only through that exchange of information between the caregiver and the patient are we really going to be able to provide what I think is the best care for each patient.